Alright guys, we are live. Let's see here. That's good. No, I think it's good. Alright, we're back in the operating room, you guys. We're going live, Dr. Barrett here. I'm just going to make some adjustments on the angles so you all can see me and I can see you. Okay. Alright, so we're going to talk about mommy makeovers, and we have a couple questions that we're going to go through for mommy makeovers. Are they worth it? What's involved? How long does it take to recover from a mommy makeover? How painful is a mommy makeover? Typical cost of a mommy makeover? How safe is a mommy makeover? How much weight do you lose with a mommy makeover? Can you walk after a mommy makeover? What should I eat after a mommy makeover? Do I have to lose weight before a mommy makeover? Is there an age limit for a mommy makeover? That's a lot. And when is the best time to get a mommy makeover, right? So number one, we're going to start about, are mommy makeovers worth it? Well, the worth it rating on Real Self, which is a plastic surgery website, is about 97% nationwide. There's no other procedure that has such a worth it rating, okay? So that's the main reason why is because combined with the tummy tuck and a breast lift and so forth. So what is involved with the mommy makeover? That's probably the best first question. A mommy makeover is typically some sort of breast rejuvenation after, you know, when we say mommy makeover, it's kind of like after having kids or after having a weight loss or just kind of a way to get your body back, okay? From either of those things. So imagine you have kids, your tummy gets bigger because of the baby, your muscles widen because of the rectus diastasis, and you have a lot of swelling with the breast, breastfeeding, and the babies really do a number on it, right? So typically a mommy makeover has breast rejuvenation and then some type of tummy rejuvenation. Now breast can be three things. It can be an augmentation, it can be a lift, or it could be an augmentation and a lift, all right? So that's the typical things that happen with the breast, and that actually determines the pricing a lot, okay? Next is the tummy tuck. Almost always after having a baby, people might need a tummy tuck where we repair the muscles on the inside, and then we get rid of a lot of the extra skin as well and lower that incision. So at least the way I do it, we spend a lot of time on the belly button. We keep the incision super low so that you can't see that, okay? It gets hidden in the bikini line. A lot of people ask me, well, I don't want the scar. But what would you rather have? A belly that's out to here or a scar that you can hide underneath in your bikini line? So, and then lastly, I call it a grand slam mommy makeover. We can take some of the fat we do with the liposuction, because sometimes we do liposuction with the tummy tuck, and transfer it to the buttocks. So three areas: breast, tummy, and buttock area. Okay, so keep watching here, guys. Make sure you ask your questions. I'll get to them at the end, okay? How long does it take to recover from a mommy makeover? I tell everybody it's pretty much, at least the way I do it, is about 2 weeks. Off work for 2 weeks. Full recovery is probably about 6 weeks, right? But you know, 2 weeks off work for most jobs. I inject a lot of numbing medicine. I do a lot of rapid recovery techniques. I have a lot of supplements. So it might be 3 to 4 weeks for other doctors, but for myself, it's about 2 weeks. And I've had some people recover as fast as 10 days. The main reason why that you need the recovery time is that plication that we do in the middle. Okay, that plication is affecting your core, it's repairing your core. You need to get that time to heal. How painful is a mommy makeover? Well, it's not that it's painful. I mean, there are certain areas that are painful, right? If we do implants, the breasts are going to be a bit painful. If we do the tummy tuck, you're going to have that plication, which is kind of painful. A lot of people compare it to a C-section, so it is kind of a real deal, and it takes that first week, you're kind of feeling it. But we do have a lot of alternative pain medication in addition to narcotic pain medication that we offer. CBD is a game changer, magnesium is a game changer. Those are some things that you can take to augment your recovery. Movement helps you heal. You're kind of hunched over at first, but you want to stand up straight over 5 days because the more you're kind of hunched over, the more your lower back starts to hurt. So I give people about 5 days of that, and then I want you back straight. And don't worry, at least the way I do it, I close in 4 or 5 layers, so you're not going to have anything that pops open, okay? Typical cost of a mommy makeover depends on what we do, but it's anywhere from $30,000 to $70,000 here in our office. Although other places across the country can go as low as $15,000 sometimes. Okay, but we're in Beverly Hills. I spend a lot of time on these surgeries. I'm very experienced, and this is my bread and butter. This is what I do. I'm not a factory, but this is what I specialize in to make your body makeover as perfect as can be. Two things you don't want to bargain shop for: parachutes and plastic surgery. Okay, so you only get one body unless you believe in reincarnation. So it's not like a car. You don't want to buy, you can't buy it and then trade it in because you don't like the seats, whatever. Okay, I always say that. Anyway, how safe is the mommy makeover? Mommy makeover is pretty safe. Now, the tummy tuck aspect of that is the most dangerous part, and the most dangerous part of that is the blood clots that you can get from it. So that's why we have our patients walk around right away. We send all of our patients home with these leg squeezers. Nobody else does that. We send you home with portable leg squeezers, so that it helps squeeze the legs and prevent those blood clots from happening. And the third thing we do is we give you some blood thinning medication that we take, that we have you take for at least 1 to 2 weeks. Okay, with those, we've been able to reduce our complication rate with DVTs, which is deep venous thrombosis. The problem with those blood clots is they can start in the leg and they can go to your lung. The risk of that is pretty low. The risk of death from a tummy tuck is about 1 in 10,000, so it does happen. Okay, so it is something to be aware of. Make sure that your surgeon does all those different things, limits your amount of time in surgery so that those complications can stay on the lower side. All right. How much weight do you lose with a mommy makeover? It's not much weight, believe it or not, but most people lose probably an average of like 10 to 15 pounds combined with the skin and the fat that we remove. It's more about the appearance that we're working on for the mommy makeover. Can you walk after a mommy makeover? Absolutely. We want to walk right away. You want to walk at least 3 times a day. You want to walk the same day of your surgery. That's when you're most at risk for those blood clots. What you don't want to do is be in a long car ride home after your mommy makeover surgery. Okay, so if you're in a car for longer than an hour, you got to get up, you got to walk around. Okay, so that's why I have most of my patients, they'll stay at an aftercare facility the first night afterwards, or at least staying close by. And you want to get up and walk around. Movement helps you heal. The bed puts you closer to the grave. Okay, so the bed is only for rest. That's the only thing you want to do in bed is sleep, and then you get up and you walk around, sit around, do what you got to do. Okay. What should I eat after a mommy makeover? It really depends on what your diet is, but nutritious foods. Try to stay away from processed foods, but really whatever you can get, because a lot of times your appetite gets decreased, and you need about 20% more calories to heal from a mommy makeover surgery. So I like creation protein smoothies, stuff like that. Just augment. Don't worry about gaining weight. You won't gain weight, but your body needs a lot of that nutrition to heal. How do I lose weight before a mommy makeover? Well, there are lots of ways to lose weight, but a physiological way to lose weight is with intermittent fasting. Our bodies evolved over millions of years to not have 3 meals a day, but maybe 1 or 2 meals a day. So the biggest thing I tell people that works every single time is you stop eating your dinner, let's say 7 o'clock at night, and you don't eat anything until 11 a.m. the next day. That's no cream, there's no sugar in your coffee, right? That is 0 calories. From 7 o'clock at night to 11 a.m. the next day, you will lose 20 pounds in a month. I guarantee it, if you need to lose weight, okay? But just be careful with your electrolytes. I had a buddy who did it, and he had to go to the hospital because he wasn't keeping up with his electrolytes, and he lost literally 20 pounds in a week. It was kind of intense. It's amazing how that works. You can actually eat whatever you want in that eating window, that 8-hour eating window, but the inflammation in your body goes down because your gut finally gets a chance to heal. I know, that contrary to what you've been hearing and what we've been brainwashed that we have to calorie count. Well, calorie counting is a myth. It's what you eat and when you eat it. Now, when it comes to what you're eating, if you could just focus on the time frame first, and the next thing you want to do to optimize that is to stick with a keto-based diet. Nothing preservative, nothing in a bag. When you go to the grocery store, stay on the perimeter, right? That's where all the best foods are, okay? Do I have to lose, so how much weight do you lose? Okay, so we talked about that. And then we are on, is there an age limit for mommy makeover? No, there isn't. As long as you're healthy and you don't have any major cardiac issues, pretty much anybody can get a mommy makeover, right? So it's not so much an age limit for that. There is sometimes a weight limit, but it's more in terms of your health. So I have some people with a BMI that's 35 or greater. I don't have a hard cutoff. I basically have a really long discussion with my patients. If you are in that higher weight category, are you healthy? Are there other problems that we need to get taken care of first? Sometimes we can just do a paniculectomy to get rid of the extra skin so you can fit in the clothes that you want, and then we can come back once you lose weight. Some people need that. They need that little extra boost because they can't even carry around the skin. They can't even get in clothes. Okay, so sometimes we do stage things where we take off the extra skin and we can come back in another time and do the actual full tummy tuck. All right, when is the best time to get a mommy makeover? Right now. Actually, when you're done having kids, right? You don't want to do a mommy makeover, then have another kid, then we got to start over. If it happens, no big deal. It's not going to stop you from having kids. But ideally, if you're done having kids, let's get started then, okay? Also make sure to do it in a time when you have some time for recovery, okay? You want to make sure you have a good support network, support system, so that you can spend the amount of time that you need for recovery, okay? All right, so let's open up to your questions, you guys. Do you suggest getting BBL at the same time? Yes, that is from Lindsay, I do, because there is a huge opportunity with the fat that we take if we do the liposuction with the tummy tuck that we can then transfer to the buttocks, okay? What's included with a mommy makeover? Well, we answered that in the beginning, but I'll go over it one more time. It's typically some type of breast rejuvenation, either breast augmentation, breast lift, or combo. Tummy tuck, typically with application repair, sometimes a hernia repair, because if you get a little umbilical hernia with pregnancy, we could fix that. And then liposuction and abdomen flanks. And now about that hernia repair, insurance can sometimes cover that, so do keep that in mind. And then sometimes we can actually do a trap fat transfer to buttocks. If we want the buttocks to look a little bit bigger, a little bit more rejuvenated, might as well use that fat to transfer to the buttocks. My question to you is, how many old people do you see with a beautiful full-shaped butt? You don't. So if you have the fat, you might as well use it. Because when you're 80 years old, you'll be like, oh, that Dr. Barrett, he was right. I lost my butt. I should have put that fat somewhere, all right? Okay, I'm new here. How are you? I'm great. And where are you located? User 96914. I'm located in Beverly Hills. That's Neiman Marcus right behind me, and that's Wilshire Boulevard. We're right here in the Beverly Hills Triangle. I'm in my surgery center. We actually had 4 surgeries today and a cyst removal. They went really well. So please come see me here in Beverly Hills. If you want to get a consultation, write this down or type it in. It's drdanielbarrett.com, a virtual consultation portion of my website, okay? Submit your information and some photos. I'll look at it, and we can kind of come up with a plan for you if you like, or we can either meet in the office, or we can meet virtually through the web browser or the webcam. I don't know. I feel like I'm selling pornography. Zoom, but the Zoom, right? Okay. So, okay. I need to know what laser is good for scars or for breast lift. You know, it's for scarring. I typically rely on the CO2 laser, but if you have darker skin, we might need to do microneedling. All right. Doesn't the fat get absorbed by the body and you have to keep doing it? Delco, yes, the fat does get absorbed by the body a certain percentage, but a certain percentage stays, okay? So we lose anywhere from 30 to 40% whenever we do a fat transfer for a mommy makeover, okay? Let's see what else we have here, guys. Oh yeah, by the way, I have my Instagram account. I did a surgery today on my Instagram, so make sure you guys check that out. Dr. Daniel Barrett is my Instagram handle. And for those of you on my Instagram, make sure you check out my TikToks. I have some cool stuff on there, some fun stuff, some informative stuff now. We're switching to some more informative type of TikToks versus the crazy memes. So that handle is Barrett Plastic Surgery on TikTok. And then of course, if you want a comprehensive education on everything that I do, it's on my YouTube. Just Google Dr. Barrett Plastic Surgery YouTube, and you'll get like a really good selection of videos that you can actually learn more about procedures and my take on a lot of stuff. I also have a podcast, the Natural Plastic Surgeon Podcast. Make sure that you check that out as well, okay? Say you get the BBL, do you have to go for the massages? No, you don't have to. Lymphatic massage certainly helps a lot of people, but there's no evidence that says that it really helps. I do recommend some form of massage, a venous legacy, or radiofrequency skin tightening after any type of liposuction procedure that we offer all of our patients. Any colleagues you recommend in Texas? Frankie's mommy. It depends on what part of Texas, but I think I get a lot of patients from Texas. I would love for you to just come visit me here. It's a really quick and easy flight, Dallas, Houston, wherever you're at. And we really cater to the out of town patients if you're not here. So we have everything lined up for you. So tell me, is it better to do it all at once or different surgeries for mommy makeover? Mary D, it's better to do it all at once in my opinion, unless you want to break it up. But like you're going to double your recovery. You're going to not double your cost, but you're going to increase your cost. The first hour of OR and anesthesia always is most expensive. So we want to kind of knock that all out in one time frame, okay? But use your judgment. Do whatever you feel comfortable with. I don't know what OMM as a DO means, user 857. And you guys, we go live every week, so make sure you follow me. And you can follow me on Instagram, Dr. Daniel Barrett is my handle. And then also follow my TikTok, Barrett Plastic Surgery, where we go live once a week as well. And then also make sure to subscribe to my YouTube because we got Zach over here. And Zach works really hard on the YouTube channel, and he has actually our YouTube shorts And our YouTube Shorts is on fire right now, so we have a lot of cool stuff that's happening on YouTube Shorts. Who likes TikTok? Who likes Instagram? Who likes YouTube Shorts? You know, I always want to know, but they're all like really competing. It's Instagram is on Reels obviously right now, and they're actually going over to, they're getting away from photos and they're going to videos. But you got to check out our YouTube because we can get away with a lot more over there. And then of course we have Snapchat. Any Snapchat users still out there? Perverted people, maybe, I don't know. All right, so do I do rhinoplasty, Emily? Yes, I do. I do rhinoplasty all the time. I've got one coming up very soon, and I had a post-op, a 3-week post-op that was a major revision rhinoplasty. I didn't film it yesterday, but we will film that probably at our 4-month where most of that swelling goes down. And then when you have a BBL, is it okay to sit on the BBL pillow for 2 weeks after? Yes, we actually send all of our patients home with a BBL pillow, okay? So if a BBL is part of your mommy makeover, we try to keep the pressure off the buttocks. It's kind of hard, but we have some recommendations for our patients to offload the pressure off the BBL. As you know, you want to make sure that you get pressure off the buttocks for at least 2 weeks is my ideal. Get up, walk around, especially. Do you want somebody just asked about inflammatory foods. Yes, but different foods are inflammatory to different people. I recommend an Everlywell food sensitivity test. Write that down. Everlywell food sensitivity test. I don't make any money from them. I've taken their test multiple times. I've been able to actually overcome a lot of my leaky gut syndrome and test the effectiveness of my treatment for leaky gut by taking that food sensitivity test. I did a comprehensive food sensitivity test. It's at home. You prick your finger, you put your blood on the little piece of paper, you send it off. It tells you which foods you're sensitive to. And if you're sensitive to a lot, it means you have leaky gut. If you're sensitive to 1 or 2, just maybe eliminate it from your diet. But if you ever notice you feel kind of crappy if you eat certain foods, that could be a sign. Anyway, I'm digressing, but yes, you want to avoid inflammatory foods. You want good, healthy foods when you are recovering prior to surgery and then after surgery, okay? So a lot of people forget about that optimization coming up to surgery. You know, you want to make sure you optimize your health prior to surgery. Yes, I do require labs for all my patients. Sometimes we catch things. Sometimes we catch people that are pregnant. They don't know they're pregnant. And in fact, we've actually done laboratory studies on a patient who was not pregnant, and then just a few days later, we did one more urine test right the morning of her surgery, found out she was pregnant. Of course, we gave her all her money back. She went home and she had her baby eventually, and they've been happy. We haven't heard from them, so they're probably like, damn it, I wish I had had my surgery, but you know, it's all good. All right, here's a YouTube question, Miss Elise. I had a BBL 4 months ago. How long do I have to wait until I can get my mommy makeover? You know, you're ready now. 4 months is totally plenty of time to recover after previous procedure. I would say normally we want to wait 3 months between procedures, ideally, to make sure that you're kind of fully healed and ready to go. After extensive weight loss, is uplift enough or is augmentation generally needed? Yes, Gavin, that depends. So the reason why I like augmentation with a lift most of the time is for that upper pole fullness. Yes, you're gonna get a huge gain with a lift, but if you really want that upper pole fullness, a little bit of an implant kind of goes a long way. Now you can also do fat transfer as well. I do a lot of fat transfer. You can check out my website, naturalbreastaugmentation.com. I have a lot of fat transfer that I do there. And I'm one of the few docs in Beverly Hills that does a lot of fat transfer in or with implants, okay? So Ping 357. If you've had implants and want to remove them, what happens with the skin going from a 34 double D to an A cup? Well, skin's not going to be happy, but there's a chance that you might need a lift at that time. So, you know, again, if you want me to figure that out for you, submit your request on virtual, you know, my virtual consultation page at drdanielbarrett.com. I will get back to you. Also, you know, you can also like leave comments, questions on my Instagram as well at Dr. Daniel Barrett. All right, we're going to get a few more questions in, then I'm going to film some TikToks with the team because they've been waiting patiently for me all day today. Can I do fat transfer under local anesthesia? Frankie's mommy, yes, you can, but it's really painful, and I recommend just to go to sleep, get the fat taken care of, and then get it transferred. Megan's story, what kind of work do you do? I do head to toe plastic surgery. I'm a face, breast and body expert, noses, you name it. My goal is to make it look good for you, okay? And look natural. All right, I have another question on YouTube. Joshua, on my way to lose 140 pounds. Are you able to do a male tummy tuck and gyno at the same time? Yes, I do them all the time. For the male chest reduction, this is a surgery that I've had myself. It's called gynecomastia surgery. I developed a minimally invasive technique using a microdebrider so that you don't need to have the big scar here. So if you're interested in gynecomastia surgery, please come see me. Check out my website at Dr. Daniel Barrett. And you'll see that none of my patients have scars. None of them have these big shark bites that is required for the traditional way where they scoop out the glandular tissue and they leave you with a shark bite. I do everything endoscopically and I gently remove the tissue. I wish I had this operation when I had mine done because I have a big scar and I have a little bit of a shark bite, especially when I raise my arm up. Maybe I'll show you guys sometime so you can kind of see. But we're talking about mommy makeovers mostly over here. Estimated length of surgery time for a mommy makeover depends, but it's anywhere from 4 to 6 hours. I really try to keep it under 6 hours because at that 6-hour mark, your complication rate starts to go up. Okay, so I'm pretty efficient. I'm not cutting corners, but I'm pretty efficient with this many years of experience that I have. How much swelling is there after surgery for breast reduction? There's a lot of swelling, so 6 weeks is generally what I tell people if you get a breast reduction for that swelling to go down. Because remember, we have to combine the liposuction with actual physical removal of the tissue, so that can cause a lot of swelling. I tell people the breasts look like aliens for about 6 weeks. And sometimes we do that, a reduction for mommy makeover. So that's another option for the breast portion of that. Can someone with anemia get mommy makeover? Hungry mama, yes, it's possible. It just depends on how low your anemia is, but why are you anemic and why can't we fix it? Do we need to take iron? Are you a vegetarian? You need to eat meat? You know, I respect vegetarians, I respect vegans, but there's just not enough nutrients in vegan or vegetarian food to really sustain optimal wellness for people, okay? But use your own judgment on that. If that's important to you, you just have to understand and overcome the nutritional deficiencies of a vegan or vegetarian diet, okay guys? But I respect that. How long after a baby do you recommend having a mommy makeover? Mark, I'd say at least 3 months, but ideally 6, okay? There's a lot of swelling and everything that goes on. There's a lot of swelling that goes on after having a baby, as you know, and there's probably baby weight that you want to lose. And there's just a lot going on in general with the baby, and you don't really want to be recovering from surgery while your baby's waking up every 2 hours in the middle of the night, stabbing at you, biting you, all this other stuff, okay? Hopefully they don't have teeth, but yeah. Is a tummy tuck scar permanent? Yes, it is, Stacy, but there's a lot of things you can do to reduce it. The rule number 1 is you want to get it low, okay? So I do low tummy tuck scars, all right? So they're hidden in the bikini line. I do a 4-layer closure. I meticulously handle the skin edges. I do tension offloading sutures. I tape for 6 weeks. I do a scar management protocol for 6 months, and then we can do laser if we need to really further blend it away, okay? A couple more questions, you guys. And then we're gonna move on here. Okay, how long after VSG to have a mommy makeover? What is VSG? VSG. Not sure what VSG is, guys. Doc, how about Morpheus 8? Does that work for loose skin? Valerie, yes, it does. It works. It works a fair amount. But again, nothing comes close to getting a tummy tuck in terms of the amount of skin that you can remove. So if you just have a small amount of laxity, Morpheus will help the external skin, and maybe you can combine it with a radiofrequency deeper down with like Venus Legacy or Thermage. But yeah, if you have to ask about Morpheus 8, you probably need a tummy tuck, okay? Cavitation is terrible for you, correctly? Cavitation in terms of what? Face planted Chicago, let me know. Where are you located, you guys? I'm in Beverly Hills. This is Neiman Marcus behind me. My website is drdanielbarrett.com. I have virtual consultations on there. Follow me on Instagram, Dr. Daniel Barrett. You can DM me. Okay, I get back to all my DMs. You could also check out my TikToks on Barrett Plastic Surgery for TikTok, okay? Let's see. Follow-up breast reduction, what limits the size I could go down from E to F as possible? You know, for breast reduction, I tell people, you really don't want to go much smaller than a C cup because then it starts to look different. It doesn't quite look like a breast. You could get down to a B, but then it starts to look really unusually shaped. So I tell people, most people, the smallest you really want to go and keep it looking like a breast, C cup. But if you do want to go smaller, you just have to accept that risk that it might look pretty funky. All right, there's only so much you can do. We can do reduce a breast. Okay. What if you have stretch marks for a tummy tuck? Tummy tuck is generally there to get rid of the stretch marks. So if you have them, get a tummy tuck and it gets rid of it. Okay. All right, guys, that's it for all my live today. Thank you for tuning in. We're going to do this again next week, so make sure you follow me so that you can get the notifications when we go live. Thank you so much. Oh, and check out my surgeries tomorrow on Instagram, Dr. Daniel Barrett. We're going to go live with that, okay? Not live.